My name is Lonnie Morris, and I am a certified nurse midwife, and I provide health care to women, or help them to obtain the health care that they need and they want. I came away from my first birth experience, the birth of my daughter, saying there got to be a better way to have a baby. This is just not what God intended for women. I felt like I was raped. I was raped by technology. I had my baby pulled out of my body when it didn't need to be pulled out of my body. My daughter later developed a seizure disorder that's caused by forceps deliveries, and we had a forceps delivery for no reason, for no reason. So 6 weeks after my daughter was born, I went back to school to study midwifery. I was a woman on a mission. I was going to be a midwife. There was no stopping me at that point. I applied to Columbia, was the only school I applied to. I got accepted, and I went to Columbia, and I was single at the time. So I was a single mother because my husband at that time was not happy with my going back to school, and just the fact that I was possessed. So I went to Columbia. I graduated from Columbia, and I went out and I applied for jobs, and they looked at me and said, "You might as well be a witch doctor. We're not going to let you into this hospital." So I kept looking and looking and looking, and I found a doctor, and he said to me, "Oh, I'll help you. You will start a birth center. You can deliver, if you get patients, you'll deliver them in the office." So I started delivering babies in the office. And the first year of practice, I delivered 69 babies in this doctor's office. Well, the state said, no, you can't do that. If you're going to deliver babies out of hospital, you're going to have to be a licensed facility. Well, there wasn't any licenses. I did a pilot and demonstration project for the state health department to prove that out-of-hospital births were safe. And I proved it. You know, we did 184 births the second year of practice. I mean, we grew. We just kept growing. And I got a grant, and then I opened up a real birth center that had, 2 birthing rooms or 3. I think it was 3 birthing rooms and a tub, and we became legitimate within 3 years. And I delivered in that birth center for 28 years, and there were just so many wonderful birth stories. And I went back to school along the way. I got my doctorate, and I continued to just grow and serve and learn and change and grow with the times, So it's been a journey, but it's been a great journey, a really great journey. I applied for hospital privileges, and finally I did get hospital privileges. And getting hospital privileges, they tried to make me fit into their mold. Oh, well, when I first started, when I went to set up my business, the state told me that I couldn't incorporate because a nurse or a nurse midwife never incorporated before. So I just got an attorney, and I filed suit against the state, and voila, we were able to incorporate. Midwives were now able to incorporate. So I was the first nurse and nurse midwife in New Jersey to incorporate her practice, because I've always been an independent practitioner. I never wanted to be owned by anybody else, because I needed to set my own standards and walk my own road, travel my own road. When we became a pilot and demonstration project for the state health department, up until that time, insurance was not paying for the births. So people that used a midwife they had to pay out of pocket. So we filed suit against, I filed suit against Blue Cross and Blue Shield of New York and New Jersey for third-party reimbursement. And we won. And they began to reimburse me. And once Blue Cross started reimbursing, then all the other commercial insurance companies began reimbursing the midwife. So I was the first midwife in the state of New Jersey to get third-party reimbursement. And that was back in the day. That was in the 80s. That was in 79, 80 is when I first started getting third-party reimbursement. Some of the highlights, I think there was so many highlights. There was so many beautiful births and beautiful stories and sad stories, but mostly beautiful stories. And there were a lot of hospital journeys because I applied to hospitals and, you know, initially we couldn't get privileges. And then by the grace of the collaborative physicians really working on it, I got privileges at the hospital. And I started out in the first hospital that I was at, and I remember I had a backup at that time who we did a twin delivery together, and I delivered the first baby, and he immediately put his hand inside and pulled the second baby out by its feet. And I asked him, I was young then, and I remember asking him, could we have waited a little bit to see if that baby would just come down? And he went nuts. You question me? I'm a board-certified obstetrician. That's the way you do it. How dare you question me? And I was like, I wasn't questioning you. I was asking a question. You know, I don't know. I've never been at a twin birth before. And I did not remain at that hospital much longer because he decided not to back me because I wasn't respectful enough. I asked a question. So I then went to work at another hospital. Inglewood Hospital. Yes, that was a journey. That was in the early 80s, and I did the unthinkable. I let a patient eat a banana in labor. So I was brought up before the quality committee, and I brought all these articles on how people could eat. And they quoted 1946 studies where women aspirated because they had general anesthesia. But these women weren't having general anesthesia. They were having a baby. But they did suspend me for letting a woman eat a banana during labor. They did put me back on staff. They made me have my collaborative physician supervise 20 more deliveries to make sure I'd be a good girl. And I got my privileges back, but you know what? I didn't want to remain in that. So I went to another hospital. But I always had the birth center, so it was the hospital-based practice was only for women who either needed the hospital or desired the hospital. You know, we didn't force people to have babies out of hospital, although it was much more beautiful and much nicer in the birth center. The birth center was fabulous. I had my own baby, my second baby in the birth center, and that's what I built it for. So I went to this third hospital. Third hospital, yes. I thought that the third hospital, being a Christian organization, would have some heart and understand that birth was a God-given function, that this is a privilege that women are given, but it's been going on for a very long time. And women can birth. Women can birth their babies. That's what they were made for. They fulfill their ultimate destiny in life by giving birth to a baby. That's your destiny. That's what I say to my patients all the time. This is your destiny, and I don't have to do anything. I don't have to fix it. I don't have to change it. Unless there's a problem, the best thing I can do is sit there and knit and allow you to have your baby. And if you need me to rub your back, I'll rub your back. But have your baby. Go in the shower. Go in the tub. Walk around. Do whatever feels right, because your body is going to tell you what feels right. If you want to dance, if you want to move, if you want to walk, you want to run, or you want to go in the shower and turn on the water and scream your brains out. It's all okay. It's right because it feels right. Well, they didn't like that too much. They didn't like women getting into the shower and not being strapped down to that fetal monitor and walking around, that was just not good. And ultimately, the backup that I had then just kind of raised the fee that I was paying. I was paying him $2,000 a month for the ability to practice my given profession. And I have to say, I don't pay my collaborative physician anything anymore. You know, we work collaboratively together. But in those years, I was paying him $2,000 a month for him to be able to bill my patients for cesarean sections and to be there, be available for a problem. I was paying him. So he raised my fee to $4,000 a month. I was being punished because I wasn't a good enough girl. You know, I didn't put them all on the monitor and, you know, pay them, you know, just do it the way they wanted me to do it. So I journeyed. I kind of stayed there and for a while, but then I left. And, you know, I always had the birth center so that it didn't matter, you know. I could stay out as much as possible by not, you know, saying to women, well, if you don't want to be at the birth center, you know, maybe you should stay with this practice, or maybe this is not, you know, because we like the birth center better. And basically, a lot of the women were then convinced that they wanted to have the baby at the birth center. We did a lot of births in the birth center. It was beautiful. We had king-size beds, and the families, after the baby was born, would all get into the bed, and they had the baby in the bed, and it was a family bed. It was great, you know. It was beautiful. It was always really beautiful, beautiful, beautiful births. In the 90s, the insurance, the malpractice crisis really happened, and the rising cost of malpractice and the inability to get cost-effective malpractice and the declining reimbursements made me look at whether I could keep the birth center open or not. And I was the first birth center to open in the state, and I was the last to close. But the other birth centers had closed in New Jersey. Ultimately, I closed the birth center, and I moved to Pascack Valley Hospital, which was the hospital that I had started at so many years ago, but they wanted the numbers. So we did an in-hospital birth center at Pascack, and it was perfect. It was lovely. They let me do what I wanted, and I was really happy there. I was happy there. We were doing lots of numbers, and then the hospital closed after 4 years. They went bankrupt because although the OB department was doing well, the rest of the hospital was not. I journeyed again. Now I didn't have a birth center, so I went to another hospital, Palisades Hospital, and again, you know, I just wasn't a good girl. Just couldn't be good. And the nurses wanted me to bring the patients in. They couldn't quite understand why I didn't want them to have an IV. Why can't you just put them on the monitor, put the IV in, and then everybody's happy? Yeah, they're happy. They can sit at the nurse's station and look at the fetal heart from the nurse's station, and this poor woman is then going to want an epidural because she can't handle it. You can't be strapped down in bed and handle a labor. You need to be mobile. You need to be allowed to labor the way you were supposed to labor a baby. They just couldn't quite get it. They couldn't quite get why my patients wanted natural childbirth to begin with. Why would you want natural childbirth? It hurts. Okay. That pain will strengthen you. That pain will change your life. You know, it says in the Bible, in pain you shall bring forth your children. Okay, so we do it. But we do it. I recall this lovely young woman. She was a weeping flower. you could blow her over with a straw. You know, a little wind. And I used to think she'd fall over. And her husband was really pushing her to have natural childbirth. He was a healthcare provider. He was a strong man. He was a chiropractor. And she was a tiny little girl giving birth to her first baby. And I worked hard. And she did it. She birthed her baby with beauty and strength, and you know, it was a beautiful birth experience. But what she said to me after made it so, you know, we worked hard together, but she said that she could never be the same woman again, that it transformed her life. It made her realize how powerful she was, how strong she felt. And it was an amazing change in this woman. It was so amazing that it personified to me really what this was all about. That pain can be so strengthening. It can change a woman's life. It could change her journey. And how great is that, you know? So, you know, I traveled around with hospitals. Of course, I left that hospital, and I'm now at another hospital where I feel respected and able to serve women. We take transports from, I always took transfers, home birth transfers from the midwives in the community, be they CPMs, CMs, CNMs, whomever the provider. If a woman needed us, we were there to serve them. Along the way, I did a lot of things for the college and for midwifery in general. In the early years, being a renegade, having an independent practice was not always, you know, the appropriate thing to do, because in 1981, I was brought up on charges for practicing medicine without a license by the Board of Medical Examiners, because I failed to diagnose a blood pressure that went from 106/64 to 120/80. And they said that patient was preeclamptic, and I should have referred her to the doctor because she was sick. It was a way that they were going to try to limit my practice. And I must admit, Sister Angela, she was a past president and a wonderful midwife who started the first birth center in the country and was my expert witness and helped me both emotionally and emotionally and medically. You know, she was my witness. And they put me on probation for a year. But it was an unspecified probation. I didn't have to do anything. I just had to keep my nose clean for a year, but it never went away. I mean, you always have to report it. It was with me for the rest of my life. Today, I still report it. If I apply for privileges at a hospital, I have to report it. It's a reportable incident. I had no trouble since then. Well, I did have one trouble, but that was sealed. I was brought up on charges for doing a circumcision. And because it didn't specifically say that midwives can do circumcisions in the law, in the midwifery statute. But I was Jewish, and I had the Jewish, I was a mohelet. So when they brought me up on charges, they, court reporter and the whole thing, and they said, "Can you tell me if you only circumcised Jewish infants?" My reply was very, very honestly, if Jesus was a Jew, and a Christian is not determined a Christian until they're baptized or christened, I assume I only circumcised Jewish infants. At which point they coughed a lot. They found me not guilty, but they made me go to an ethics class. But they changed the statute. They changed New Jersey statute to include circumcision as an approved privilege, approved surgery that midwives could do. I used the legal system to extend our practice. I did testify in the early 80s at a House subcommittee hearing about the limitations of midwives' practices by the physician. And that helped a little, but that didn't make me, that didn't put me in good stead with the powers that be, the licensing bureaus. But it was something that I did do. When we had the malpractice issue, we lost our malpractice insurance, and essentially midwives across the country were not going to be forced out of practice. I hired 2 buses, as well as a hospital in Newark, Jersey City it was. I bussed 2 bus loads, and they bussed 1 bus load of pregnant women to the State House. And we stood outside the State House. I had a megaphone, and I was going, "What do we want? Insurance! When do we want it? Now!" People were carrying banners and placards that said, if you could insure cars, you can insure midwives. And, I had a signed petition that I was going to be giving to the governor when he came out of the State House. And he came out, and I presented him with this petition, and all of a sudden, "Oh, come inside, we want to speak to you." We got malpractice insurance. We did. There were a couple of legislators that said, "Oh, come inside, we'll talk to you. We'll get it. We're going to solve this right now." We went home very happy. We got malpractice insurance. And then I did go to Washington, to the A.C.N.M, and they heard my story. And a lot of the states started falling under, and they started getting malpractice insurance. And they also developed a national program through an insurance company. But we did a great job in New Jersey. There's nothing like motherhood and apple pie and big pregnant bellies to encourage the legislature to hear us. I became a fellow in the American College of Nurse Midwives, and I had to go through all of the stuff I did. And I never, I didn't think about it. It took me a really long time to write up this application, because I just did. I was always brought up with, you just do it. If it needs to be done, just do it. I was on the A.C.N.M Foundation, and they gave me, after 6 years of service, they gave me a present for serving on the foundation. And what the president said to me is, she'll never forget my attitude and my words of, "Just get it done. Let's just do it." Because that's the way I feel. There is nothing out there that you can't do. With the help of God, there's nothing out there that you can't do. So you might as well do it, or you might as well try. Because when the mission is pure, leave the rest up to God. He really does take care of mothers and babies and pure issues, journeys. And that's how I've lived my life. And whether it was financially or limitation of practice, or I just let it happen, let it evolve, and not cry. I said to a midwife yesterday, she said to me, "How did you do it all?" I said, "Well, every time I'm a weeble. I weeble, I wobble, but I don't fall down." And you just pick yourself up, dust yourself off, and get back in the race. Just do it. I said that to my kids all the time. And by the grace of God, they're all doing great too. They came out great. My baby's going to go become a midwife. I love it. I'm so excited. I know for me, I was raised on post-Holocaust. I was a post-Holocaust baby. My parents were poor. They were immigrants. And I needed to make something of myself. They encouraged us to make something of ourselves. And there must have been something there because my brother is a very successful man. And he kind of has the same, I'm just going to do it, kind of attitude. But it wasn't easy. It was not easy. My father died when I was a little girl. I was 14 years old when my dad died. My mother was a single woman cleaning houses to support herself, but just did. I went to Queens College. It was a couple of blocks away. Got my nursing degree and my associate's degree, and then I went back to school a year later and got my bachelor's, and always working as a nurse. And then when I had my first baby, it was like a life-changing event. And that's when the midwifery journey started then, because it was just so clear to me that that's not the way it was supposed to be. And some of the other things that I'm really proud of is that midwives were not allowed to sign disability and disability papers in New Jersey, but we got that. We were able to push that through as a law. We had a law, and we were the first affiliate of the American College of Nurse Midwives was New Jersey during my presidency. And I'm proud of that. I'm proud of the fact that we got independent practice in New Jersey. So you're considered now you're considered an independent practitioner. For so many years, I argued, lobbied, discussed, helped change with other midwives. There were my colleagues, Celine Digman and Karen Chris and Teresa Marsico, and there were a lot of us out there that worked very hard, on changing the regulations for nurse midwives and building those regs. And then ultimately, I guess 6 years ago, we became independent providers. And now we're considered independent. You don't have to have a doctor's signature on our license. You work now within a system that allows for collaboration and consultation with a physician, but you don't work under the physician. We finally have come of age where we're professionals, and as it should be. A family practice physician doesn't need to have a surgeon sign his paperwork so that in case he has a patient that needs an appendectomy, the surgeon will come in and do his appendectomy. Well, same for midwives. If I have a patient that gets sick or has a problem, I don't need somebody to sign my paperwork. If I call him in for a consultation on a patient, he should be thankful that I'm referring somebody, that I trust him enough and I'm referring him a patient. He says thank you to the other doctors. They refer him a patient. Why wouldn't he want to say thank you to the midwife who refers them a patient? And you work within a team. The team is as good as the players are. I work with a fabulous guy now. I actually delivered his baby. He's fabulous. He's a fabulous doctor. He works very collaboratively with us. He works and he has the same mindset. I have faculty appointment at Columbia, UMDMJ, University of Medicine and Dentistry of New Jersey, UPenn, NYU, Georgetown now, recently, Case Western Reserve. I take students. I think that we have to pass this on to the young midwives. So invariably, I have 2 students at any given time. Maybe one is in antepartum and one is in the intrapartum. They're at the hospital with me. But we take a lot of students. So we have a lot of commitment in our practice to teaching the young and let them experience it and see it firsthand and work in a setting where midwives are independent and are doing low medical intervention. So that I'm proud of doing that. I'm proud of the number of students that when I walk out, when I go to the college, when I go to the convention, and I see all these people, and they're like, "Do you remember me? I was your student," and I like it. It feels good. I don't have a lot of regrets. I have memory of one or two cases that I wish I handled differently. That maybe I had been more aware of the medical aspect, and I could have done a better job, but everything turned out all right, and it just, I was hard on myself a little bit, but I don't have a lot of regrets. Not a lot. Maybe I could have been a little sweeter sometimes, because I sometimes didn't have any patience for the doctors, but and they're trying to limit my practice, and I wasn't always as nice as I should have been. I'm much more politically correct now. As I got older, I learned how to be a little bit more politically correct. So that I regret, that I wasn't as politically correct as I should have been. But other than that, I don't know. I don't have any regrets, and I want to continue to practice. I've delivered 7,000 babies. Well, hopefully I can do more than that. I definitely want to practice for another 10 years. So that'll be a total of 48 years. So then if you practice for 48 years, maybe you should practice another 2. I don't know. We'll see. We'll see. I'm hoping that I'll be able to. I just had a birth. That was the most beautiful birth. I was crying during the birth. It was a lovely woman who had 2 girls, and her oldest girl had been present at her sister's birth. And she developed cancer 2 years ago. She's 8 or 9 years old, and she had cancer. She had bone cancer, and she was treated, and everybody's praying that she lives, and she wanted to be at the birth of her sibling. But the hospital said that only if they had room in the birth center could she be, she could be present if they got a birth center room. But oftentimes they can't get into the birth center. So someone told her that about me, and she traveled from New York to New Jersey to have a baby in Central Jersey with a midwife, this crazy midwife. And she came to me and she said, "What are the chances that you won't be able to let my daughter in?" And I said, "I guess by my death, if I'm not around. Over my dead body, maybe." So she came in, this woman came in and had the most beautiful birth. She was in the shower, and her little girl was rubbing her back in the shower, and they were singing. They were singing these beautiful songs, and she came out of the shower and singing. And they were just singing. They sang through the birth. And I delivered this baby with this little 8-year-old girl who told me for sure she wanted to be a midwife when she grew up. And she helped deliver her baby brother. And it was just so beautiful and so spiritual, and it just made me cry. Just made me cry. And it was just beautiful. And it was such an honor to be there. And to help this woman have her child, have her make a wish. And I don't get why a hospital would say, "Well, we don't know." So maybe the message is, let's change hospitals too, and make them more like the hospital I'm working in now. They're beautiful. They're wonderful. I love it. I love it. Hackensack University Medical Center at Mountainside is wonderful. For me, the heart of midwifery is being with women, with serving women, with being there for them and helping them to achieve what they want and to support them and to have a heart. The spirit and the heart of midwifery is what carries it. The mission is so pure. Midwifery is a pure profession. It is totally with women. Women with women. I know there's male midwives out there, and I love them dearly, but the heart of midwifery is being with women. And I think the A.C.N.M has it right. It's our moment of truth. Our time has come, and people are realizing it. And it's a wonderful thing to see. And I hope I'm around for a lot of years so I can see how much better it even gets. Because we fought hard, we worked hard. The midwives, I've been practicing for 38 years, and it's changed, and it's developed, and it's grown, and it's where it should be, and we still have ways to go, but it's going to get there. It's going to get there.